Hello friends, it's Dr. Zum, your favorite physical therapist. Welcome back. Today we're going to be talking about plantar fasciitis. So first I just want to give you guys some of the common symptoms of plantar fasciitis. Typically when you have plantar fasciitis, that first step in the morning is really painful, and the reason why is because your core temperature is a little bit lower, the tissues aren't as mobile, so the first couple steps you're really going to be feeling the inflammation of the plantar fascia. Additional things you're going to be feeling is sharp pains, usually right around the heel. That can kind of trickle down towards your toes. More pain with going up onto the balls of your feet or doing lateral movements with activity. Before we go into the treatment and the exercises, I want you guys to understand a little bit about the plantar fascia. So up in the corner here, you can kind of see the anatomy, and basically it's kind of like saran wrap material. It's connective tissue that comes from your calcaneus or your heel, and it extends down towards your toes. And basically, the reason you feel it more when you're on the balls of your feet is because your toes are extended and it's stretching that fascia a little bit more. So plantar fasciitis is actually some micro tears that have been sustained inside the fascia. So it's an inflammatory condition, and it's really important that you take a couple days rest after you sustain this injury, or whenever you start to notice it's hampering activity. Take a couple days off, maybe do some cycling or stuff that's not going to be putting you up or on the balls of your feet. So now that we've rested a couple days, we can get into some exercises here. I'm going to show you the first one, and basically it's just rolling out that fascia while supplying a little bit of cold modality to help to calm down the tissue. So what you're going to do here is you're going to use a frozen can of soup to apply a little bit of the cold I was telling you about. You can sit or you can stand, and you're just going to apply pressure from the base of the heel up to just before this joint. Don't put pressure on the bone, just on the fascia, and you can go to the side up on here, you can go inside and roll the foot. It should be pain-free, so if it's hurting, don't put so much pressure down on your foot. So this next one, we're going to be working on the mobility of the fascia. So this one, you're going to be stretching it. The first one, we're just kind of rolling it and getting the tissue moving a little bit without really applying any kind of tensile force on it. Actually putting tension on the fascia itself. So what I usually tell my patients is to grab a t-shirt or a towel and to roll it up to be about 1 inch or 2 thick, and you're going to place it right under your big toe. So with this under your big toe, it should not be underneath this bone here. What you're going to do is you're going to drive that knee forward over the top of your toe. So having it up like this is going to place a little bit more tension on the fascia. If you're not getting as good of a stretch, then you can always fold it additionally. Keep it under the toe. Remember, this part should be on the ground, and then you're going to drive your knee up and over the front. Next one's going to put even a little bit more strain on the plantar fascia, so make sure that you can do the previous one without pain before you go on to this next one. So for this one, you can fold it, start with just 1 inch here. Same exact position. We're going to have the toe up. This part is going to be on the ground. And you can have another foot here to balance, but you're going to be actually driving forward up onto the ball of your foot and back down. Just like this. So if it's not providing as much of a stretch, you can additionally fold it, come back, do the exact same exercise. All right, so now I'm going to show you guys a manual technique that you guys can start implementing to try to stretch this fascia in a way that's going to be a little bit more effective than just doing calf stretches. The fascia is going to come from right here on the heel, extend up and insert just on this phalanx, so the proximal phalanx here, and extend up through connective tissue into the toe itself. So you're going to put a little bit more tension on the fascia if you bend your foot or your big toe up like this. And then what you're going to do is you're going to work trigger points all along the fascia while it's taut. So you're going to start down at the base. You're going to work your way up. Once you find a tight point, what you're going to do is let the toe go back to neutral and then bring it back up, and that's going to effectively stretch that fascia. So I would do this for about 30 seconds with each trigger point that you find to help to kind of loosen up that fascia. Thanks for watching. Please don't forget to like and subscribe. Also, don't forget to message me if you have any injuries you want to know a little bit more about. All right, stay healthy.